The road to becoming a doctor is a long and strenuous process, seemingly a lifetime of education and classes, hundreds of thousands of dollars of debt, and not a single class on health insurance. All this and more on Health and Retirement.
Are you approaching your golden years? On this show, we're talking all things health, from the doctor's office to the gym and back at home. Welcome to Health in Retirement.
Welcome to Health and Retirement, the weekly talk show for golden advice for your golden years. I'm your host, Trey, Basa, Senior Healthcare Advisor with Market Medicare Advisors. I'm joined by my colleague, Cory Hiebert, also a Senior Healthcare Advisor with Market Medicare Advisors. Welcome in, Cory. Glad to have you.
Hey, Trey. Good to be back.
I wanted to start off today's show talking about us and our positions. What do we do here? And it's going to lead into a little more about doctors and networks and whatnot in today's show. Let's go ahead and talk about you brought me on about 2 years ago, and you gave me quite the laundry list of forms to fill out, hoops to jump through just to get into insurance. Let's talk about that.
Yeah, well, of course, you were coming from a background. We've known each other for a long time. I knew the type of person you were, and met you up in Manhattan, Kansas. I think it was over a dinner that we were talking a little bit about life. Where are we at now? And you were, if I remember right, you were working. Was it a retail position up in Manhattan?
Graduated, and I was just kind of in between. It was like after the COVID and everything was kind of just meh. I didn't know what was going on or what to do.
Yeah. I remember that conversation, and man, yeah, it was a rough start coming out of COVID and kind of figuring out what's kind of the lay of the land of the workplace anymore, and what are we really dealing with. And no, it was great to see you then and catch up. And I remember telling you a little bit about insurance and what I'm doing over here at Market Medicare Advisors, the journey I was starting on. And it was great to see you had a little bit of interest in it and a little bit more of a fundamental career, really a lifelong career. And it was really great to get you in. Now, I'm curious, whenever we did talk about bringing you in, what the prerequisites, what was the very first thing that on the checklist that we had to do?
I had to get licensed to the state of Kansas to even do health and life insurance, and that was a lot of studying for health and life insurance and an exam for that stuff. And
what is it? 200 questions? You get like,
I think it's 100 questions, 50 questions, and then you get a break, and then 50 more questions, in 2 parts like that.
Yeah, and like a 2-hour-long exam, and
at a testing center.
Yeah, at a testing center, they
check in,
pat you down,
turn in your phone, turn your pockets inside out, no hoodies, all that stuff.
Yeah. And
going through this test, I locked myself up for a week, just trying to study, and I had to take it 3 times. It was a lot of information to take in about health and life insurance, and what they wanted to do was make sure you had a foundational knowledge for everything. That's what the state of Kansas wants. But
well, I don't know if you remember this on the test. I remember, I get told that they want to bring me on as a Medicare advisor, and the first thing I have to do is take this health and life exam. So, I'm planning on working in the Medicare field. I'm expecting a bunch of questions on this exam to be very specifically Medicare based, and I'm brushing up on all of my Medicare knowledge. But then on this test, they're asking me questions about life insurance and annuities. And I remember on my test, it was over 3 years ago, but I remember I only got asked one question about Medicare. And I thought that was a little odd as I was going through that.
Out of 100, only one question was Medicare. And that's our main focus. But the state of Kansas had us learning about this, that, and the other with health and life insurance. We had to get this overarching licensure for the state of Kansas in order to do just our very, very niche market of Medicare. And that's important to give you a little bit of background on what we had to go through and how we relate our now experience with our clients. Because us as the insurance brokers, we're only half the equation. The other half comes from their doctors, hospitals, facilities that are facilitating their healthcare. And like I teased before at the beginning, they spend so much time, energy studying the human physiology, anatomy, just to better help their patients. But they don't do anything with insurance. That's a whole separate department of their facility. And Cory sent me this TikTok the other day, and that really sparked today's episode. So I want to go ahead and cue that up and show you guys. You guys can listen in for about 30 seconds on this.
Hey man, how's it going? Pretty tired. I'm in the middle of my step 1 dedicated study time. What's that? Oh, we get 8 weeks off to study for the step 1 medical licensing exam. 8 weeks to study for one test? Well, it's important. You have to pass it if you want to be a doctor. So you're tested on things like anatomy and physiology? Yeah. And diseases and treatment? Oh yeah. And the U.S. healthcare system? No. You don't learn about the U.S. healthcare system in doctor school? No, we're focused on other things. Because it kind of seems like the first thing they should teach you. Like, welcome to healthcare.
Welcome to healthcare.
Oh gosh, Trey, when I saw that video, it cracked me up on the inside. Because we have this conversation often, and I'll have clients they'll come to me and maybe they're taking one expensive medication, and it's just completely wrecking our financial plan, and they'll ask me, hey, what other medication could I take? What's going to be a cheaper option here? How am I going to save some money on this? And my answer every time to that question is, hey, I'm not a doctor. I'm not here. I took that test for the health insurance license. I am licensed by individual insurance companies within the Medicare field. We relicense every single year, and we retest on that stuff on an annual basis. I don't know about the human anatomy or the physiology or anything like that. And it's not my job to.
No, absolutely not. And that's the difference between us as the insurance brokers and the doctors is we have our jobs, we have our roles, and we need to work with our clients to facilitate all of these different cogs in the machine to work seamlessly. And that's what we try to get across to our clients is when we sit down, we get to know them, we get to know their doctors, prescriptions, any pre-existing health history conditions. We get to know them and find the Medicare supplement plan, Advantage plan, prescription drug plan that fits best for them and their lifestyle. So I didn't introduce it, but this is going to be our first segment, the In the Know segment. And we're going to talk a little bit about Medicare supplement plans versus Advantage plans and how doctors are not your insurance handlers. So we talk a lot about Medicare supplement, Medicare Advantage plans, and what is the big difference between those two when it comes to doctors?
Yeah, so whenever we're talking about a Medicare supplement, number one, you're going to pay a monthly premium for it, and then you're not looking at a whole lot of out-of-pocket cost. But having a Medicare supplement, no matter what insurance company's name is on the top of that card, you're allowed to go and see any doctor that accepts Medicare Part A and Part B anywhere in the United States. Now, whenever we're considering a Medicare Advantage plan, Medicare Advantage plans are going to be network-based. Your two biggest network structures being a preferred provider organization or a health maintenance organization. But you do have to be a little bit more mindful whenever we are looking at Medicare Advantage that you're going to have those networks that you're going to want to be following.
Are you in a PPO, an HMO, an FMO? Oh, wait, that's not us. That's going to be our first segment for today, In the Know. If you don't know if you're in a network or not. Hey, give us a call. Give us a call at 316-252-8707. We'd love to talk to you about what you're on or your insurance, what you could be on, if you're going to have those restrictions for a network, or if you even want to break free from your group health insurance networks. Give us a call, 316-252-8707, or you can email us at mail@marketmedicareadvisors.com, and we can have a greater conversation via electronic mail. That brings us to our second segment for today, and we're going to do a client case study. Our client case study today is going to be Joy from Newton, Kansas. We're going to talk about the Newton Medical Center, maybe some networking and contracting up in there. Joy's particular case was her doctor accepted X Medicare Advantage plan, but the hospital itself did not have that contract. So the built-in copayment for her Medicare Advantage plan for the hospital stay was not as printed. What was going to happen is she could go to her doctor, no problem, with her Medicare Advantage plan, but the hospital itself was out of network. Let's talk a little bit about problem solving with that. How do we talk to clients about this particular situation?
Yeah, well, her situation was a little bit funny. She actually brought in a packet from that Newton Medical Center had given her. And it had listed out on there, hey, these are some of the Advantage plans that we accept, and these are some of the plans that we don't, and a little bit of other information about Medicare in general. And Trey, it was a little bit funny, but it was also very disheartening to me, because as I'm looking at this form, they're not explaining the benefits properly. And from somebody that looks at these Advantage plans, and I breathe them day in, day out, I know everything about them, to have a hospital put together this packet that just has completely wrong information about Medicare Advantage. It was a little bit amusing to me, because you would think that should be a trusted source. But like we looked at in that video, these places aren't licensed in health insurance administration. And they don't have to be factually accurate because they're not giving.
In their defense, they are looking at it black and white. Mm-hmm. This is what we accept. Mm-hmm. This is not what we accept. And they list the plan names and companies, very black and white for them. But when our clients received that letter, that flyer in the mail that says we accept this, we don't accept this, and no explanation as to why whatsoever.
Yeah, no, it can definitely be a very frustrating scenario.
That was very much this fall, with a lot of people coming to us from Newton to talk about this particular flyer, because, again, it's very black and white. It is, we accepted this plan, we don't accept this plan, with no explanation. People coming to us with this flyer, and we had to sit down and talk to them about contracting. The doctors themselves, they agree to work in this medical center, but the hospital, the big portion of the medical center, doesn't have the exact same contracts as all of the doctors that work in this medical facility. Mm-hmm. And it is a beautiful facility. It is a campus.
Yeah, they do a really good job out there in Newton. And in my heart, I have no doubt that the hospital thinks that they're doing clients a service and the information that they are giving them. But ultimately, their understanding isn't always as deep as it should be. And this is why we have, I say it takes me at least one full work week every single year just to recertify with the companies I already work with on the insurance side, not counting all the new people that I want to contract with as we expand our horizons. But we do that for a reason, Trey. We don't do it just because we want to. We do it because this is an ever-changing landscape. And as horrible as this may sound, health insurance, Medicare is a game. And there are a lot of rules to this game. And if you're not paying attention to, is the rule book changing? It's constantly evolving and changing. And you don't want to be left behind because your grandparents, friends, neighbors said you need to do X, Y, and Z with your health insurance. Or even my doctor said I need to do X, Y, and Z with your insurance. I mean, that video, as much of a joke as it may be, doctors aren't required to know anything about health insurance. They're not.
They are experts in their own right, and they do their job very well.
Absolutely.
But
Absolutely.
there are more pieces to this puzzle than just physiology, anatomy. Like, by all means, they do what they do, we do what we do, and that is Medicare. So if you have a precarious problem that you want to talk to us about, you can schedule a complimentary, no obligation consultation with us here at Market Medicare Advisors. Give us a call, 316-252-8707, or again, shoot us an email, mail at marketmedicareadvisors.com, just to start a conversation. That is going to be, that's the email is always is a good segment, because that is going to be our mailbag for today. The mailbag is going to be an email question we got just the other week. Question coming from a viewer just like you, straight to our inbox. Let's talk about Ruby in Kansas City. Ruby asks, if my doctor doesn't deal with my insurance, then who does? How do I know that insurance is the right fit for me? How do I know that if the insurance company has my best interests in mind? We're talking a lot about experts, specialists for XYZ. Doctors do what they do. Medicare insurance brokers do what we do. We are, by all means, we are certified and licensed to be talking about insurance and signing you guys up for XYZ, making sure you have what you need. So I want to address that first question. If my doctor doesn't deal with my insurance, then who does? Well, you wouldn't hire a plumber to fix your electricity, right?
No.
They have their own career path, licensure, certification. They are working to, let's stick with the plumber. They're working to focus on plumbing, to be an expert, to be that go-to expert for plumbing. Your doctor is going to be your best advocate for your health, and Market Medicare Advisor is going to be your best advocate for Medicare insurance.
Yeah, well, whenever we talk about, Ruby, fantastic question, who deals with my insurance? At Market Medicare Advisors, we try to be as helpful to every single person that we can. And we're certified in several different lines of insurance because everybody's situation's a little bit different. But we also know that, there are certain people that we may not be the right fit for them. And that's okay. And it's okay if we're not going to be the person that you want to talk to. But if it's not going to be us, let it be another Medicare broker. Let it be somebody local. Because whenever you're talking to these people on the phone that call you and want to sign you up to a plan, or if you're going online and you're picking something because it said that it had this really, really cool gym
Benefit,
membership that you really wanted, or whatever it may be.
They're going to do everything they can to get you to call in. They want you to call.
What we do and what a local broker should do with you is we're going to sit down, and before we even talk about Medicare, we're going to learn about your situation. Where do you work? How long have you worked there? Are you currently retired? Is retirement on the horizon? What doctors do you see? What medications do you take? What's your financial position heading into retirement? And Trey, those conversations can last a while. And clients look at me kind of funny because we'll be 40 minutes into a meeting and I haven't said the word Medicare once, because all of that information is going to dictate what we talk about in terms of Medicare. Because everybody's spot is so much different. And if we don't take the time to know the person sitting in front of us, then we're yelling into the void if we're just talking Medicare facts, black and white.
And that's going to be the difference between the phone number that you guys call on the television and a face-to-face meeting with an insurance broker. The guy on the other line isn't going to ask you about your doctors, your prescriptions. They're not going to get to know you and your situation. Here at Market Medicare Advisors, we dedicate at least 40 minutes just to get to know you, your situation, because it's important that you are signing up for Medicare and you only want to do it once. You want to do it right. So that's going to be it for today. Ruby, thank you so much for your question. Thank you so much for joining me, Cory. Thank you, viewers, for joining us here today on Health and Retirement. Be sure to check out our website, MedicareAdvisors.com, if you want to get to know me or Cory a little bit better. We got some nice bios on there, or even set up an appointment with any of our advisors here at MedicareAdvisors.com. I also want to plug the rest of our firm's shows at MarketMediaNetwork.com. Check out other shows to help you retire and give you all of that free information about retirement. Even if you're thinking about it, just watch a show, see what you can get from it. Anyway, my name's Trey.
And I'm Cory.
Hey, thanks for joining us today for another episode of Health and Retirement, the weekly talk show for golden advice for your golden years. We'll see you next time.
Unless otherwise indicated, all client and prospect names mentioned on this show have been changed to protect the identities of the individuals discussed. The content provided is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers. This is not endorsed or affiliated with any U.S. government agency, the Social Security Administration, or associated with any federal Medicare program. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. All rights reserved.